Well, all right, we're back with Dr. Pakman. Dr. Pakman, let me ask you, we just talked a little bit about missing teeth and that they can create all kinds of problems, headaches, tensions, grinding of teeth, which in itself ruins them and all that. Now, what are some of the methods to replace them with missing teeth? There must be many of them, and give us some feedback which one is maybe better or better for a certain situation.
Right. Well, there's several methods to replace missing teeth, and there are basically three of them, and I'll give them to you. One is with a removable appliance. Everyone knows an aunt or an uncle or a grandparent that wears a partial denture or a full denture. These are appliances that fill in the missing teeth but are removable. They come in and out. Usually they take them out to sleep. The second method to replace missing teeth, if you have sound teeth on each side of the space, is what we call fixed bridge work, which each tooth is capped. There's a false tooth in between that cements in over the prepared teeth. That's a fixed bridge. The latest way we have of replacing teeth, which is fantastic and which we try to encourage people to do, is with dental implants. Very simply, a dental implant is a titanium root that is placed by a surgeon into the jaw, and then a crown can be attached to it or a denture can be attached to it. So those are basically the three ways of replacing missing teeth.
Okay, and there's obviously a cost factor involved. With no doubt, the removable is the cheapest. The crown is probably the second cheapest, and the implant the most cheapest. But let me ask you: when you do 3 crowns, I mean, when you do a bridge, you really do 3 crowns, 3 units, as you fix the 2 which hold the one in the middle, right?
Exactly.
And each one does cost some money. So the 3 together, are they really a lot more than the 1 implant alone, or is the cost relatively? Whatever. Just give me an average there, a good feeling about it.
That's an interesting question. Generally speaking, the cost of 1 implant is more than a 3-unit bridge, which would replace 1 tooth.
Okay.
However, the cost is not so overwhelming. It's not double the cost. It might be a third, again, of the cost of a traditional bridge. The advantage to the implant, and this is very important, is that when you have teeth on either side of a space that have no fillings in them or any kind of dental disease, you're preserving the tooth structure by putting an implant in. If you're putting a 3-unit bridge in, you've got to grind those teeth down. And sometimes we don't want to do that to healthy tooth structure.
I got it.
That's one of the major advantages.
I got it. Now, I also have heard that when a person has a bridge, meaning 3 teeth, that when a person has a bridge, meaning 3 teeth, it is extremely difficult to floss in there, and thus that area tends to develop periodontal disease, which leads to, again, tooth floss, but more importantly, to inflammation and infection in that area.
Right, correct. When anyone has a fixed bridge or even a single crown, they have to be more meticulous about their home care, because these things, let's face it, they're foreign objects. You weren't born with the bridge in your mouth. So they will collect more plaque, more calculus, so that they have to be meticulously cleaned and, of course, maintained every 6 months when you go to your dentist.
Okay. All right. Now, and if a person puts one of those removable in terms of like, I right now have no money, but in half a year or whatever, I might have some money for the implant. Would that be a workable solution?
Absolutely, and there are many times that we do that, where we'll sort of transition the patient from having no teeth or not having a tooth there, wearing a partial denture until they can either afford or have the surgery done for the implant. So that's a viable alternative.
All right. And what do you think lasts on an average longer, an implant or a crown or a bridge, kind of?
Without a doubt, the implant will last longer. Once the implant has integrated into the bone, which in the lower jaw usually takes about 3 months, the upper jaw takes about 6 months, that implant is actually fused into the bone. So these things will last probably your lifetime.
Well, that's good to hear.
It is.
That's wonderful. Well, all right. Anything else patients should be knowing about any of those three procedures?
Well, when I do implants, I usually refer the implant for the surgical phase to either an oral surgeon or a periodontist. These are the practitioners that have the most expertise in doing this surgical procedure.
Okay. So basically, it definitely should be done expertly.
Absolutely.
Well, all right. Well, thanks for letting us know. I'll speak to you soon.
Bye-bye.